Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. In the Going Deep segment brought to you by CO2 Lift, today we're joined by our regular resident expert, the Plastics Doc himself, Dr. Samuel Salcedo. He's a board-certified plastic surgeon and the founder of TPD MD in Corona, California. Renowned for his expertise in aesthetic plastic surgery, he's really dedicated to delivering that personalized care and achieving natural-looking results. He is highly respected in his field, presenting at national and international conferences, training other surgeons in surgical techniques, and publishing studies in the highest-rated plastic surgery journals. He's going to join us right now to chat all about healing in heat. He'll share his expertise on how to manage post-procedure skin recovery in the hot summer months. Welcome to the show, superstar.
Thanks a lot, Zen. Healing in heat. I love it. This is going to be a hot discussion. Let's go.
Let's dive right in. So in the summer, we often see an increased demand for treatments surrounding travel, with many looking to refresh their appearance before jetting off or to even restore their skin after returning from that sun-soaked vacation. In your experience, what types of treatments tend to be the most popular or highly requested during the summer months at your practice?
Just think bikini. Okay, so anything that really shows more prominence in a bikini is where we see that uptick in procedures. So think of breast augmentation, liposuction, cellulite treatments, and tummy tucks, because that's what people want to do. They want to look great in their bikinis. They want to go to the beach and show off those bodies. So they start looking at those areas. What do I need to enhance before I go out on the beach? And it ends up being breast, tummy, lipo, and specifically cellulite.
Okay, well then that all makes sense. Now you put it into perspective from top to bottom.
Yep.
Now let's chat about the safe treatment timeline. So with summer often comes travel and outdoor activities in the sun and in the water. These are all things to keep in mind when, of course, scheduling any aesthetic treatment, as pre and post procedure routines they vary. So how do you typically advise patients to time their procedures around summer activities, and what key things should they keep in mind during the pre and post treatment periods to ensure that safe recovery and those optimal results?
Yeah, that's a great question that a lot of patients don't ask enough. I like to start with basically a standard timeline of about 2 weeks. I find that is the optimal healing time for most procedures. Now, specifically when we're talking about lipo, we're talking about incisions that are very small. So those heal quickly. Usually that can be a week and a half to 2 weeks. Non-invasive treatments like our Ovally cellulite device, those also tiny, tiny incisions. So those heal quickly. When it comes to larger procedures like breast augmentation or tummy tuck, where we have longer incisions, I usually like to say a safe rule of thumb is about 2 weeks. Now, activity really involves how active you're going to get. So if you're doing light activities, walking on the beach, doing light hikes, things like that, you can get to that in about a week. But if you're going to be doing really intense lifting, pushing, pulling, or working out, I like to really stick to that 2-week timeline as a minimum for the healing timeline.
I really thought you were going to say more. 2 weeks is actually not that bad, considering, some of these procedures you would think a decade ago would have required the full month. So I'm glad that there's been advancements, because liposuction is at a very different place today than it was a decade ago, right? Everything is advancing very quickly.
Well,
now there's, go ahead.
Yeah, let me go back and say this though, regarding the tummy tuck and breast augmentations, more invasive procedures. The data shows that our wounds are at 80% healed by 6 weeks, meaning they're not 100% yet. So in essence, to get to 100% full activity, you should wait for 6 weeks before you get into full bore activity.
Yeah, like if you're getting on a jet ski, obviously that's a full-blown activity with a lot of muscle requirement holding that, the steering. So yes, exactly. I'm glad we pointed that out. Now, there are several ways patients can support and even speed up the healing process, which is what we're talking about right now, especially when they're eager to get back to that beach. So I want to focus on CO2 Lift, because this is at the heart of everything we talk about when it comes to healing. So you often utilize the CO2 Lift Pro mask in your recovery protocol. Can you break down how CO2 Lift aids in barrier repair, in hydration retention, and even inflammation reduction, and specifically supports healing overall? Can you get into that, please?
Yeah, absolutely. So I definitely want to get into our enhanced recovery protocol, which CO2 is a key component of that. CO2 has really changed the game in post-operative recovery. For us, what CO2 Lift does is it utilizes a principle called the Bohr effect, which is where you have CO2 concentration it goes transdermally. So we apply the mask, the CO2 lift goes transdermally, meaning through the skin. It increases the concentration of CO2 in the tissues, which causes the body to bring oxygen to balance that out. And anytime we have an increased flow of oxygen into an area that's healing in particular, you're going to have better healing. You're going to have quicker healing because it's bringing the nutrients, the oxygen, all the things that are needed for the cells to heal. So that speeds up wound recovery. It actually helps with scarring. So it does all the things that we need it to do to enhance recovery quicker.
And I love it that it's clinically researched, clinically verified. They have the data to back it up. And that neoangiogenesis that you're talking about is what every surgeon is looking for. You need that blood flow to rush to that area so we can start to see that repair. And I think what you just said is spot on. This is so proprietary that CO2, you've said it, but other experts have come on and said it themselves, has changed the game in post-surgery recovery. Now, what
Yeah.
are some
I
other...
love that you got more scientific than me with it. Talking about neoangiogenesis. I was trying to avoid getting too deep, and then you're like, yeah, neoangiogenesis, the Bohr effect. And I'm like, well, okay. All right, good for you.
Um, I learned so much from experts like yourself. It's the
Yeah.
only reason I know this stuff. Now, what are some other options you recommend for your patients to help in the recovery period to heal safely? What
Yeah.
specifically when dealing with summer-specific challenges like sun exposure and sweat and environmental
Mhm.
irritants? How does that change everything?
Yeah, so I really want to touch up on the enhanced recovery protocol because it's super important. So obviously CO2 lift is a mainstay of that, but when it comes to doing your procedures, it starts in the operating room. So one thing that we do is we apply something called Exparel, which is a long-acting numbing medication. It acts for 3 days. It's liposomal bupivacaine, and it releases that bupivacaine slowly over 3 days so that we can minimize the use of narcotics. Some patients don't even have to take opioid narcotics at all. It reduces the pain so that patients can get back to activity sooner, meaning the more you're active, the more you get inflammation and swelling out. So that's number one. Number two, we use CO2 lift at the time of surgery. That helps aid in recovery, speed recovery, minimize bruising and swelling, which also helps with pain. So that's number two. Number three, we supply our patients with Juven, which is a nutritional supplement. It has vitamins, minerals, amino acids. It's a powder that they put in there. They can put in water or some other juice, and that helps tremendously speed up the recovery and provide the building blocks that they need to get back to activity sooner. We also add red light therapy. Red light therapy is another way to bring oxygen into the tissues and help speed recovery, and then silicone scar gel. So between those things, we have our enhanced recovery protocol down to a science that can help patients recover where it used to be, like you said, some people used to say, I knew somebody who got a tummy tuck and they were in bed for 3 months. Absolutely not. We have patients walking on day one. We have them doing light activity for the first week. And like we just talked about, within 2 weeks, they're back to moderate, almost full activity because we have the science and the technology to allow people to recover quicker and recover better. This is the golden age of medicine, right? We're able to advance these things. It's not your grandmother's surgery anymore.
Yeah, no, you're 100% right. And I'm going to go one step further. So with everything that you just said, do you adjust your treatment approach based on the time of the year? Like, for example, are there certain procedures you recommend more or less during the summer? And do you modify that pre and post care protocol, or are they typically the same during year round?
Yeah. So the pre and post protocol remains the same because whether it's summer or winter, I want patients to recover quick and have the least pain and the least use of pain medication. So that doesn't change. But what does change is the seasonality of procedures. So obviously in the summer, I tell patients to avoid a lot of things like lasers and chemical peels, things that damage the skin and make you susceptible to sun damage. So we actually see a big slowdown in that. And I don't recommend doing those procedures in the summer. What I do recommend is, like we talked about before, liposuction, cellulite treatments, things that are moderately invasive, small incisions, and quick recovery.
I love that you flipped the script, because if I had not known any better, I would have thought all those procedures should be done in the wintertime, not in the summer months, to be able to get, back to where I should be for the summertime. But I love that the recovery post surgery now is half of what it used to be, which is game changer, and that you could see results right away. I mean, think of that. You're going to Hawaii and you go get, a liposuction 2 weeks before. You're a whole different body when you get there. This is fantastic.
Absolutely. Absolutely. Yeah, it's the new age of medicine, right? We have all this technology that can help us get to that healing point in half the time.
Now, lastly, before we wrap up, for someone who may be nervous about booking a treatment or a procedure in the middle of summer, what would you say to reassure them? I mean, based on everything we talked about today, how do you set them on the right track with the right steps and products in place to recover safely and comfortably, even in, I'm talking about more of the heat, like it's hot, you want sutures, you want bandages, like how do you tell people, no, it's okay. Summertime is actually okay to do this.
Yeah. So the number one thing, again, like I say all the time, is find an experienced surgeon, a board certified plastic surgeon, someone who uses the technologies that I use and has an enhanced recovery protocol to help you get through the worst part as quickly as possible. But you bring up a good point. There are some things that you just have to deal with. You're going to have to, if you get lipo, you're going to be wearing a faja for compression. That's going to get hot in the summer. If you do a tummy tuck, you're going to have bandages for a few days. So that's why you should give yourself a little buffer of time, probably that first week, because there's no way to avoid drains,
Yeah.
bandages, compression garments. You will have to deal with that. So that's why we have that sort of 2-week timeline so that patients don't find themselves in a really bad position. Like you said, out on the beach in Hawaii with drains coming out of their sides and bandages, like that's just a terrible scenario.
Right. And I love that we talked about that peak heat because yes, just because the recovery time is 2 weeks, it doesn't mean you don't have to deal with all of the nuances of that recovery, whether it's the drains or the sutures or the, compression garments. And yes, that will be in the dead of heat. So maybe time, if we talk about proper timeline in that spring area, just leading into the summertime where, you don't have to torture yourself.
Yeah, absolutely. We see a big uptick in March and April as everybody's
Yes.
preparing for the summer. The procedure rates just go sky high. And then we have a little bit of a summer slowdown. And then guess what? When everybody goes back to school and puts their kids in school, then we see that uptick again when patients have time to come back and do surgeries.
Yeah, yeah, and like those laser treatments, like you said, not in the dead of
Hmm. Of
summer, but closer to the fall. Well, we are at the end of this, my friend. Thank you so much for joining us straight
course.
from
Thanks for
Hawaii.
having me.
I love that you're so diligent about making sure that you're contributing and your appearances stay
Always,
on point, even on vacation. That's dedication.
always, always.
All right, well, go back to enjoying that beautiful sun. That was the Plastics Doc himself, Dr. Samuel Salcedo. You can check him out directly on the gram at TPD MD, and you can also check him out directly at tpdmd.com. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to co2lift.com.